Okay, looks like we're on. Let's just do this again. I'm sorry, we've been having some technical difficulties. And this is Group 17. My name is Peter Tomasovic. I will be the PMHMP that's interviewing a patient. We have an adjustment disorder that was assigned to our group. Go ahead, introduce yourself if you should.
And my name is Larisha Taylor, and I will be the student in this assignment.
Thank you. You're going to be the patient,
I'm
and that's fine. And then we have Chigozim that she's not here, but we're going to try to record this the way the best we can, and then send her a copy that she can review and do her part. Okay, here we go. So my name is Peter Tomasovic. I am a psychiatric mental health nurse practitioner, and everything that we discuss here today is private and confidential except if there are any concerns about that you might express about harming yourself or someone else, I have a duty to report that. Does that sound okay to you?
Yes, sir.
Thank you so much. Do you mind telling me your first and last name and your date of birth?
Yes, Sarah Johnson, May the 14th, 1991.
Thank you, Sarah. It's nice to meet you. How would you like to be called?
Sarah.
Oh, great. Thank you. And what concerns do you have today? What brings you here today?
I have not been feeling like myself since my dad passed away.
Oh, I'm sorry to hear that. And how long ago was that your dad passed?
About 2 months ago.
Okay. And you said you haven't been feeling yourself. Is this something that started about the same time?
Yes, it started after my dad passed away 2 months ago.
Okay. And will you be able to tell me a little bit more about it? What symptoms do you have? What you've been feeling?
Um, I sometimes have trouble sleeping, thinking about my father. I'm slower in the mornings, and everything feel tougher. I tear up and have trouble focusing at work. I'm afraid I may lose my job, and also sometimes I feel like I'm a bad parent.
Oh, I'm sorry to hear that. Those are some feelings that are not easy to deal with, and I'm going to do my help to help you. Okay. Thank you for answering all these questions. And again, if at any point you're not comfortable answering any of my questions, please say so. It's quite okay. How often do you feel like that in a week?
Maybe 1 to 2 days out of the week.
Okay. And would you able to tell me a little bit more about these feelings that you have?
The feelings that I have is it's kind of hard for me to fall asleep like I used to. I don't have much energy. There are days when I feel a little better, but I can't stop thinking about my dad, which makes it really hard for me to focus and get things done.
I understand that. I'm going to ask you more specific questions about the issues that you mentioned, and I'm going to start with your sleep. And how would you say, how many hours of sleep do you get at night?
I would say maybe about 6 or 7 hours.
Okay. And the issues that you have with your sleep, is it falling asleep or staying asleep or waking up early?
I have trouble with falling asleep. Like staying asleep, I'm okay, but falling asleep, I'm tossing and turning. I'm focusing on my dad. I'm thinking about him. It's just sometimes it's a mess because I cannot get to sleep.
I understand. Is there anything that overall, not just your sleep, but how you feel about everything, does anything make things better or worse? Anything that you do?
I would say what make things better is when my husband and we watch movies, and also when I play and just tire myself out with the kids. Um I would say what makes things worse is when my family is forcing me to socialize, and I'm just not ready to move forward with that.
I understand. That's not easy to deal with, and especially when you've been asked questions and you have to entertain other people. And how often does that happen?
Uh maybe about 1 to 2 days out of the week.
Okay, thank you. And how severely is this impacting you? Let's just say on a scale from 0 to 10, 0, no impact at all, 10, the worst possible.
I would say maybe about 2 to 3.
Okay, thank you. And the issues and the symptoms that you mentioned, are they affecting your daily living?
Well, I do have less energy and I cry often and have trouble focusing at work.
Hmm. And has this been stressful for you? Has this uh, changed anything?
The only thing is changed is like my kind of sleeping patterns and just mood. I mean, just think, just I'm just like on and off. But for its changes, uh, I just have a hard time focusing at work at this point.
Okay. All right. And beside the sleep and the focus that you mentioned, and do you have any other symptoms, any worrying that you might have, or anything else that you want to talk about?
Yes, I feel sad thinking about my dad and all the memories that keep coming back. I know it's part of the life. I mean, I know it's part of losing a loved one, but I just cannot get over it. My husband and friends have observed that I am avoiding going out and being around family members, which is different from previously. I don't like to be around people. I worry about losing my job, but I did have a yearly assessment at work and I did pretty well on the assessment. It wasn't no type of recommendations with my supervisor, so I did well on that.
Oh, great. I'm glad to hear that. So it sounds like you're getting some good feedbacks from your boss, and that's really good to know. Have you ever had any mental health concerns in the past?
No.
Okay. Um, the next several questions are going to be general health questions, and the reason for it is because sometimes, if we're dealing with some issues that are affecting our general health, it can contribute to our mental health issues or be the main cause of it. Okay, so I do appreciate your honesty, and again, if you're not comfortable answering any of them, please say so. Okay, have you ever had any in the past several weeks any fever, chills, any weight loss or fatigue?
Just no weight loss, just a little fatigue.
Okay. Thank you. And your eyes, any changes to your vision, any blurry vision or double vision?
No, sir.
Okay. And the glasses that you're wearing, are those reader glasses or they're prescription glasses?
These are readers.
Okay, thank you. Any issues with your hearing, any hearing loss or ear pain or sore throat?
No, sir.
Okay. Any chest pain or heart racing, like palpitations, difficulties breathing?
No, no, sir.
Thank you. Any cough, any shortness of breath, any wheezing?
No, sir.
Okay. Any nausea, vomiting, constipation, abdominal pain?
No, sir.
Okay. Any issues passing urine, like incontinence or any blood in your urine that you noticed?
No, sir.
Okay, thank you. Any joint pain, back pain, muscle aches?
No, sir.
Okay. Have you noticed any changes to your skin, any new lesions or rash or itching?
No, sir. I haven't noticed anything.
Great, thank you. Have you ever had seizure in your life?
No, sir.
Okay. Any headaches, dizziness, weakness, numbness in your extremities?
No, sir.
Okay. Have you ever been told that you have issues with a bleeding, any easy bruising?
No, sir.
Okay, thank you. Have you ever been told that you have any issues um, with any of your glands, like a heat intolerance or hard time regulating your blood sugar?
No, sir.
Thank you. Any allergies?
No, sir.
Okay. Do you have in your family any history of mental health problems?
No, sir.
Thank you. Any history of medical problems in your family?
My mom passed away from breast cancer.
Oh, I'm sorry to hear that. And how long ago was that?
It was like about 10 years ago.
Okay. And you mentioned your father passed 2 months ago. Did he have any mental health issues? What did he pass from?
My dad passed away from a heart attack and he had diabetes
Okay.
and also high blood pressure.
Thank you. And do you have any siblings?
Yes, I have two brothers, no sisters.
Okay. Do they have any mental health issues or health issues that you know of?
No, sir.
Okay. Great. Thank you for that. Okay. Now I'm going to ask a little bit more questions about you and your background. Do you currently work?
Yes, I work at the local high school. I'm a counselor
Okay.
there, a school counselor.
Thank you, Sarah. And what is the highest level of your education?
I have a bachelor's degree college.
Thank you.
Mhm.
And are you currently in a relationship?
Yes, I've been married for 8 years.
Great. Thank you. Congratulations. Do you have
Thank you.
any children?
Yes, I have a 3-year-old girl and a 5-year-old boy.
Thank you. And do you guys all live together?
Yes, my husband and I and the children.
Great. And where do you guys live? And what are your accommodations?
We have a 4-bedroom house.
Great. Thank you. And I'm going to ask you now about your support system. You mentioned you have two siblings. Are you close with them?
Yes, my support system. Yes, I do have a support system. It would be my husband and both of my brothers, as
Great.
well as my church members.
Oh, great. Thank you. Sounds like you have a really good support system. That's very
Yes,
good.
I do. Thank you.
Welcome. And a little bit more about your developmental history. Have you ever had any developmental delays as a child? Do you remember?
No, I have met all of my milestones on time.
Thank you. And a little bit more about your childhood. Can you tell me, were you raised by your parents or someone else?
I was raised by both of my parents, and I have two of my siblings. Um, we're very close, so yeah, I was raised by both of my parents.
Thank you. Do you have any medical conditions, any diagnosis that you were
Uh,
given by a doctor?
well, the doctor said that I have high blood pressure.
Oh, okay. Are you on any medications for that blood pressure?
I take lisinopril. I think it's like 10 milligrams a day.
Great. Thank you. And do you have a GYN doctor that you see?
I do. Yes,
Okay,
sir.
great. Any medical issues as far as that goes? Any um, issues that you've been dealing with?
No, not at all. No, no type of bleeding or anything like that. No.
Great. Thank you. And when was your last menstrual period?
It was April, believe it's like April the 1st or the 2nd, somewhere up in there. It was the first week in April.
Thank you. And you mentioned you have two kids. Any miscarriages or premature deliveries?
No, my kids was full term.
Okay. Was it a C-section or a vaginal birth?
It was a vaginal birth.
Thank you for answering all my questions. I really appreciate that. Have you, you mentioned you didn't have any mental health issues in the past. Have you ever been um, treated in a psychiatric setting, hospitalization or the clinic, or giving any medications at all in your life?
No, sir.
Okay. Have you ever had any psychotherapy in the past?
No, sir.
Okay. The next several questions are going to be potentially uncomfortable. And again, if you're not comfortable answering them, that's okay. Please say so. Okay. I just need to get as much information as I can so I can properly come up with a solution for your issues, Sarah. So, do you currently smoke or use any tobacco products?
No, sir.
Have you ever used them in your past?
No, sir.
Okay. Do you consume alcoholic beverages?
Alcohol beverages. I would say I drink occasionally, like a glass of wine, maybe once or twice a month.
Okay, thank you. And do you drink any caffeinated beverages?
Yes, I drink at least two cups of coffee
Okay.
a day.
And do you drink them in the morning, in the afternoon? What would that be?
Uh, I drink one in the morning and one in the afternoon.
Okay, thank you. And any substance use in your past ever? Any illicit drugs in the past or current?
No.
Okay, thank you. And I'm going to ask you potentially uncomfortable questions, okay, about your sexual orientation. How do you describe yourself? Are you heterosexual or not?
Heterosexual.
Okay, and you mentioned you married, and your gender, you're declaring
Female.
yourself as female. Thank you.
Yes.
And are you sexually active?
Yes, my husband and I.
Okay. Are you guys using any contraceptive measures?
Not at this time.
Okay. Do you have any legal issues or in the past?
No, sir.
Okay. Well, thank you so much, Sarah. I know this was not easy to answer. I do appreciate your honesty. We're going to move on, and I'm going to ask you a little bit more in depth about your symptoms, okay? So, any changes in your mood, in your interest, any excessive worry that you might be dealing with?
Yes, sir.
What would that be? The
Um, just, I think it's the worrying part. My mood is okay. Um, just, just tossing. I think it's I just feel like I'm kind of all over the place
okay,
with my interests and my mood.
okay, gotcha. How's your
I
appetite?
mean, not my mood. I'm sorry, worrying.
You're worrying.
My mood is fine. I'm
Okay,
sorry.
okay, that's okay. And your appetite, is it okay?
My appetite is good.
Okay. How about your focus and your concentration?
I do have less focus and concentration every now and then.
Okay, okay. And can you walk me through your regular day? How does it look like?
So basically my day, I wake up at 6 a.m., I make breakfast and getting the kids ready for preschool. My husband, he drops them off. I drive myself to work. I leave work around 5 p.m., pick up the kids from daycare and then home. I make dinner. I play with the kids. We may do some homework and then we're a bath and we're off to sleep.
Okay. Well, sounds like a very busy day.
Yes.
I'm going to ask you a little bit more questions about your thoughts. Anything unusual that you notice? Any thoughts that doesn't sound like they make sense?
No.
No. Do you feel like anyone is following you or trying to harm you?
Mm-mm, no, sir.
Okay. Any voices that are telling you what to do or are coming from inside your head or from the outside?
No, sir.
Okay. Any things that you see that no one else can see around you?
No, sir.
Okay. And this next question is going to be potentially uncomfortable, but it's important to properly understand the severity and feelings that you are dealing with. So I apologize about if you find it offending in any way, but do you have any thoughts about harming yourself or someone else?
No, sir.
Okay. Um, do you know what today's date is?
Yes, today is April the 12th, 2026.
Excellent. Thank you. And do you know where we are right now?
Yes, I am in the clinic, top of minds clinic.
Thank you. And do you know why we're here?
We're here because the passing of my dad.
Okay.
Um, just not feeling myself. My husband and my coworkers kind of felt like I should come and see and talk to someone like you. So I am here for that reason.
Thank you, Sarah, for being here, and I think you made the right decision. Um, the next question would be a hypothetical question. So let's just imagine that the fire breaks out and it's engulfing the whole office. What would your next step be? What would you do?
Oh my, I would leave and get help.
Well, thank you for that.
Yes, sir.
I appreciate it. Okay, so the next few minutes we're going to be talking a little bit more in depth about some of the symptoms that you mentioned. Okay, so I'm going to assess the anxiety, I'm going to assess your mood, and then the suicide potential as well, suicidality. Okay, so the first is a GAD-7 screening tool for anxiety. It has 7 questions. And I'm going to ask you a question. You're going to tell me if you are dealing with this at all, or if you have some days of the week, most days of the week, or almost every day. Okay.
Okay.
So, for the past 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on edge?
Not at all.
Okay. How about not being able to stop or control worrying?
Probably several days.
Thank you. How about worrying too much about different things?
No, not at all.
How about trouble relaxing?
Yes, several days.
Okay. Thank you. How about being restless and it's hard to stay still?
Probably several days.
Okay. How about becoming easily annoyed or irritable?
No, not at all.
Okay. Feeling afraid as if something awful is going to happen?
Not at all.
Okay. So the symptoms that you mentioned, are there causing you difficulties at work, or at home or getting along with other people? Would you say no difficulties at all, some difficulties, very difficulties, or extremely difficult?
Somewhat difficult.
Somewhat. Okay.
So,
Thank you, Sarah. Okay, so the next 9 questions are going to be asking you the issues, and you're going to tell me if they're affecting you in any way and how often. Okay. So, have you in the past 2 weeks have been experiencing a little interest or pleasure in doing things?
maybe several days.
Okay. How about feeling down, depressed, or hopeless?
No.
Trouble falling or staying asleep, or sleeping too much?
Probably several days.
Okay. Feeling tired or having little energy?
Yes.
How often?
Oh, several days. I'm sorry.
Thank you. How about poor appetite or overeating?
No, not at all.
Feeling bad about yourself? Feeling like a failure?
No, not at all.
Trouble concentrating on things, such as reading newspaper or watching television?
Mm, no, I wouldn't say necessary. Not able. No, not at all.
Moving or speaking slowly so other people could have noticed that? Or being fidgety and restless?
No, not at all.
Thoughts that you would be better off dead or hurting yourself?
Mm, no, not at all.
Thank you. Okay, so the last few questions are about the suicide, okay? So again, I apologize if you find them offensive. I just have to assess this as well and have it on your records. Have you wished that you were dead or wished you could go to sleep and not wake up?
No,
Thank you. Have you actually had any thoughts of killing yourself?
no, sir.
Okay, thank you. Have you ever done anything, started to do anything, or prepared to do anything to end your life?
No, sir.
Okay. Thank you for your honesty, Sarah. At this point, I am looking at several diagnoses. One of them is major depressive disorder. That's where we're talking about your mood being a little bit lower than usual and how you feel about yourself and other people and socializing. Then there's an insomnia disorder that you reported having issues falling asleep. And then the diagnosis that I'm going to go with is an adjustment disorder. What that is, Sarah, it's a disorder that's happening when there is an issue that we can pinpoint and that's causing the changes in how you feel. And for you, that's the passing of your father that was 2 months ago. And the good news about this disorder is that it it gets better with time. You might need some help, and I'm going to help you with that. I'm going to make some recommendations for you, but the full recovery usually happens within 6 months or sooner. Okay. So my suggestion first is I will make you referral for psychotherapy. You're going to see a specialist who does cognitive behavior therapy, and they'll help you with developing some coping skills and help you with some emotions that you might find overwhelming and dealing with them. Also, you can do a grief counseling and join some support groups with people who have lost their loved ones. And you can participate this in the online form as well if you don't have time for that. And a lot of people find them very useful. The other recommendations that I have is non-pharmacological, which means you're not medication related. I don't think that at this point, with your mild symptoms, you need any medication. So we're going to try to do some other stuff before. Sleep hygiene will be one recommendation that I will have. I think that maybe having the second cup of coffee earlier in the day, not later in the afternoon, will help. Also, decreasing the screen time if you're watching TV or using your phone before falling asleep. And then when you have an alcoholic beverage, try not to have it right before sleep because that can delay your sleep as well and affect it in a negative way. I will also make a recommendation in increasing physical exercises, maybe walking or doing some weightlifting exercises. It will help your energy level, your mood, and your sleep as well. And then, as far as the stress management goes, maybe some breathing exercises, or when you feel overwhelmed, maybe you can reach out to your husband and maybe he can take over some of the responsibilities around the kids and you can have some more time for yourself or to your family members as well. And then mindfulness is also very useful if you can maybe meditate or do some yoga to just take your mind off some issues, especially when you are feeling overwhelmed. How does that sound to you? Is any of this
Yeah,
something that you can?
yeah, I think that sounds really, really good. I can definitely do that.
Well, thank you, Sarah. I think you're going to do fine. You have very mild symptoms, like I said. You have a strong support system in place, and I'm not very concerned about you at this point. But I do want you to know that if you're not feeling any better, or if you start feeling worse, if you start having some thoughts about hurting yourself or someone else, or if you feel like your mood is going down or your energy level, please call this clinic as soon as you can. I would like to see you in 2 weeks, where we're going to see if there is any progress in how you feel and if there's any need for medications at that point. Does that sound okay with you?
Yes, sir.
Thank you, Sarah. Do you have any questions or suggestions?
No, sir, not at this time.
All right, Sarah, thank you again for coming, and I'll see you in 2 weeks.
Thank you, sir.
Thank you.